Good afternoon, everyone. It is my great honor and privilege to welcome you all most warmly this day to the CSR Universe COVID Response Impact Awards and Conference 2021. The award has been constituted by the CSR Universe to recognize and highlight the best COVID response initiatives taken by the corporate and social sectors in India since the outbreak of the pandemic in March 2020. As COVID presented new challenges for corporates, NGOs, and implementation agencies, corporate social responsibility emerged as an emancipator and a rescuer amid this crisis by contributing significantly to the changing social needs. This was the time when quick relief measures and extraordinary efforts exhibited by corporates went beyond CSR policy expectations. During this period, the CSR Universe team continued speaking to CSR leaders who shared their thoughts and insights on tackling COVID challenges with their CSR efforts. Hence, began our quest to find and recognize the best CSR projects conceptualized and executed during the pandemic. The focus of today's awards is to identify COVID specific best social projects and recognize companies that followed innovative techniques to reach out to communities hit hard by the pandemic. We also have taken into consideration the strategic approaches of corporates and how well they could implement the same with their partners. And here we have gathered to facilitate sustainable and scalable social projects and CSR solutions based on COVID specific learnings, and to acknowledge corporates' efforts in CSR during the COVID times that are leading by examples even during this crisis. Let me now very briefly share the process that my team at the CSR Universe followed for the selection of the best social projects. So we pursued a multi-stage process where at level one, we invited nominations by the corporates, not-for-profits, and also the CSR Universe editorial team. Well-being response from social sector organizations and corporates. A total of 286 corporates and NGOs showed interest in filling nomination forms by inquiring via phone, mail, LinkedIn, and filling the contact form. A total of 93 nominations were received at the end of our deadline on August 10. A total of 76 nominations were found to be valid. Out of those, the internal team of the editorial team of CSR Universe selected 36 and sent it across to our jury members. So we had 8 categories of award, and here is the presentation, So we had 8 categories. There is education, health, skill development, women and child development, food and nutrition, research and development, microfinance, and awareness campaigns. So at the third and the most crucial stage, we had invited a 6-member jury panel comprising CSR veterans, top NGO and CSR leaders, renowned academicians, and policy enablers to judge the entries on for the following criteria: project concept, innovation, execution strategy, impact, project scalability, project sustainability, and lastly, community participation. So our packed jury for selecting the best social project includes stalwart academicians like Professor Shalini Bharat, the VC and Director of Tata Institute of Social Sciences, Mumbai, Dr. Rishikesh T. Krishnan, Director, IIM Bangalore, Dr. Himanshu Roy, Director, IIM Indore, Dr. Umakant Das, Director, Institute of Rural Management, Anand. And we also have renowned social sector experts in the jury like Mr. Nixon Joseph, who's the ex-president and CEO of SBI Foundation, and Mr. Sanjay Sinha, the managing director of MGRIL. I would like to extend my gratitude and appreciation to the distinguished jury members for their consistent support and guidance. So these were the nomination highlights. So as you can see, we had received 36 nominations in the health category, which was the highest. And out of those, only 24 nominations were valid because the others could not reach the criteria we had mentioned in our forms. And in health and nutrition, we had 20 nominations which were valid, and skill and development and livelihood and education had 15 and 14 entries respectively. Microfinance and women and childcare, however, did not receive any nomination, and there was only one entry for research and development. In the spreading awareness category, we had 5 entries, and there was a nomination in the special category of sports. So out of these 36 shortlisted for our jury and the internal team got down to 21 finalists who made it to the winning team, two winners. So thank you. So I would like to now tell you about the main agenda of today's conference. It's basically to accumulate insights from visionaries, futurists, and thought leaders towards creating sustainable models for social challenges that have emerged after the outbreak of COVID-19. For that purpose, we have invited corporate and social sector leaders to share their insights on different aspects of social sector response to COVID pandemic and the role of corporates in dealing with these emerging social challenges. Hence, on behalf of the entire team of the CSR Universe, I would like to take this opportunity to thank our esteemed speakers for accepting our invitation and sharing their valuable time with us. Now we look forward to their thought-provoking insights on issues of sustainable development during such challenging times. I hope that today's ideas and discussions will inspire communities across and pave the way for a better future of sustainable CSR efforts and development. Now, without further delay, I invite and welcome my dear colleague, Dr. Shweta Singh, who is the consulting editor at the CSR Universe, who is also a fellow at Ashoka University and has worked with the CII and various other organizations, to be our moderator for the first panel discussion on healthcare solutions in COVID times, finding sustainable models, opportunities, and challenges, to introduce our esteemed and initiate the session. Welcome, Shweta.
Thank you, Ruchika. Good afternoon, everyone. First of all, let me wish you a very happy Ganesh Chaturthi. It's a festival day, and I have to give a special thank you to all those who have joined us today. This session is about healthcare solutions during COVID times, finding sustainable models and discussing the opportunities and challenges that are involved. I extend a very warm welcome to our eminent panelists we have with us, Mr. Nixon Joseph. He was also a jury member. He's currently the Chief Executive of Children's Love Castles Trust, India. He also served as the Vice President and Chief Operations Officer at SBI Foundation. We have with us Mr. A. Sudhakar, who is the CSR head at Dabur, India, and leads the entire CSR operations for the organization. We have Ms. Shachi Singh, founder and general secretary of the organization Ehsaas. She's been working for marginalized sections for over 3 decades now, with both national and international recognitions, including the National Award for Child Welfare. We are also joined by Mr. Ankur Bisen. He's the author of the book Wasted, which is an amazing read on the historical and social intricacies of sanitation in India. I am Shweta. Ruchika has already introduced me. I'm the consulting editor at the CSR Universe, and I'd be taking the discussion forward. Now, I think we would all agree that COVID pandemic was the worst crisis.
Excuse me, Shweta, Ms. Shachi Singh is also there.
Yes, I mentioned also her. There. Yes, I saw her. I just talked about her. Sorry. Yes, I was saying that COVID pandemic was, in my opinion, and I think all of you would agree with me, that it was one of the worst crises the modern world has witnessed. But it did serve as a wake-up call, rather rude wake-up call, to focus our attention to one of the most basic human requirements, that's of health. We saw how vulnerable our whole country was in this particular domain. Now, hoping that the worst phase is behind us, we can look back and evaluate our efforts and try to work out the best way forward. Apparently, or it seems at least, that we're moving in the right direction with the union budget allocation for health and well-being standing at over 223,000 crores. This is an increase of 137% over the previous year. And here, as we're talking about CSR, it must be noted that the total CSR spent during 2020-21 was estimated to be around 22,000 crores, the highest since the CSR Act came into being. Now, this is despite the fact that the profits were shrinking during the pandemic. While we do not have a conclusive breakup available with us, it is still expected that most of this amount was spent on COVID relief. We ourselves had the privilege of going through many amazing initiatives as we screened the entries. Not unexpected, healthcare received the highest number of nominations. These included massive projects that collaborated with state governments at all levels, right from top to bottom, and innovative ones that involved artificial intelligence and robotics and blockchain to streamline testing and tracking and vaccinations. The projects were amazing to read. It was a privilege to go through them. Although this session is about highlighting the best ways to strengthen healthcare for the future, to ensure that if, God forbid, we ever are faced with such a crisis again, we are well prepared for it. So I'd like to begin businesses played during with Mr. Do you think that the businesses, what role did they have? Did they fulfill their duty?
I think Dr. Shweta has some connective issue.
Hello?
Yeah, yeah.
Ruchika, can you hear me?
Yes, we can hear you. We can hear you, Shweta.
Please continue.
Was I audible?
No.
Okay.
Shweta,
I don't know what was the last thing that you heard.
Shweta, the last 2 minutes were not audible.
Audible, yeah.
Yeah, it is possible that you can switch off your video so that you have the bandwidth and you can repeat the question and to the person you want that person to answer.
Sure. I'll just turn off my video. I think that's a good idea. Yes. I hope that's better.
Yes, it's better.
What I was mentioning, that I'd like to begin the discussion with each panelist discussing their views and observation about the role that businesses played during the pandemic. How well do you think they fulfilled their responsibilities? What were the high points? What were the strengths of their initiatives? How could they have done better? I mean, your personal observations on the situation. So I'd like to begin with Mr. Joseph. Could you please share your thoughts on this, sir?
Okay. Good afternoon, everyone. And thank you, CSR Universe, for organizing this panel discussion on a very relevant topic. This pandemic took all of us on a surprise. And I would tell that both the government as well as corporates, all of us were unprepared for the crisis before us. But all the corporates rose up to the occasion and directed the CSR funds towards addressing these adversities brought by this pandemic. So we find that though most of the, like a substantial portion of the CSR funds would have gone to PMKS fund, the corporates also on their own did a lot of CSR activities to address the crisis. Like from SBI Foundation, and also I think similar foundations elsewhere also, all of them had focused on providing immediate relief to those affected. So providing ration kits, providing even prepared food, dry food, all these were done by the corporates. And taking care of the healthcare workers, there are a lot of initiatives to provide PPE kits, masks, then relevant medical equipments, etc. I found many corporates donating ventilators. Within the first wave, ventilators were very much required, and we could see many corporates taking efforts to provide ventilators. Similarly, whatever healthcare workers required, to a great extent were addressed by the CSR foundations, corporates, even government side also. In fact, I think all the organization stakeholders came together to address the first wave and even second wave, and also in getting ready for the third wave as well. There have been a lot of hurdles in the sense that none of the organizations were well prepared. The demands were not properly assessed, and that would have resulted in a lot of unavoidable sad situations. But then this is something a lesson for not only for India, but for all the everywhere. We were not aware of what to expect, how to respond, etc. But I feel that though there have been a lot of lives lost, etc., every organization tried to learn from this and also responded to it in a very positive way. Therefore, short-term to take care of immediate relief measures, everyone came together. The same way, the face of the crisis has been the migrant moving from one part of India to another part of India. That summarized the crisis. In fact, no one were aware about the importance of these migrants. So it's only after seeing this situation only, even government, all over the agencies came to be aware that there is something to be done. These migrants are also important stakeholders in this economy. So, but subsequently, many of these issues have been addressed, but then there are a lot to be done. And even healthcare also, as I told, as an immediate remedy, PPE kits, all these were provided. Subsequently, due to amendment in the CSR regulations, it was told whatever is done for COVID relief would be considered as a CSR. Even temporary hospitals, temporary COVID camps and all would be considered as CSR. Therefore, a lot of funds have gone from corporate side, CSR side, for increasing the capacity, increasing the number of ICU rooms, increasing the number of beds, etc. in various hospitals. That is also there. And many of the corporates, including SBA Foundation, with which I was associated till May, we have supported even research activities. We have tied up with Indian Institute of Science for doing research in activities to fight COVID. Similarly, many corporates also would have supported in this direction. And even genome sequencing, we have donated 10 crores. So that various, not only immediate relief, but interim measures, midterm, long-term, in all those way, corporates have supported. There are a lot of gaps, I fully agree, that we have to accept, considering that India is a very huge, large country with a huge population and also inadequate data. So all these would have contributed to or aggravated the crisis. But then I feel if we see from the CSR perspective, a lot of funds have gone into mitigating the adverse effects of COVID.
Okay, sir. Thank you so much. I'd now ask Sudhakar, sir, to share his insights.
Yeah, thanks, Sweta.
Yes, sir. Yes.
I'll just share our own experience in Dabur. I think,
Sure.
that will be closer to our heart in terms of communicating what we could do in the past 18 months. See, March 2020, when the COVID hit us first time, frankly, we were at a loss to understand what can we do and what should we do. the first thing we did was in April, I think first week, when PM Care Fund was formed, as Mr. Joseph said, we said, let's put some money in the PM Care funds. As a group, we contributed 11 crores to the fund. And then we started thinking what else we can do on our own. First thing is we have contributed to the national cause. Then what can we do in our communities we have worked? The first thing we found was that, in terms of masking the entire communities where we are, whether it is employees, families, and the about 100 odd villages, we work in 5 states. So we thought, first, let us talk about the masking. So we involved our skill development centers in preparing the masks, because that time masks were also in scarcity. They were not available. So we thought, now how do you expect a village community people to come to the towns to pick up the masks? And so let's have a master trainer. First, we did that. Second, we said, we talk about sanitization. What do we do? Schools were all shut. And that is where we said, we need to, how do we do advocacy? That was also tough, but we managed to, because since we have CSR personnel in all the locations, we ensured advocacy with regard to sanitization of their households, and then what are the precautions we need to do besides social distancing or safe distancing. So these are all things we did. As we picked up pace in terms of understanding, migrant labor, as Mr. Joseph said, was a big task, because our own factories depend on a lot of labor moving from Bihar, Uttar Pradesh, states like this. So what do we do? So first, that was one point, whether it is a distribution of dry rations or engaging with organizations like Akshay Patra in supporting their initiatives in terms of nutrition, etc. We started doing in terms of both in cash and kind. Those are activities we started doing. So that's it. Then we felt that there are a lot of needs as the wave 2 hit in terms of the oxygen availability, COVID care centers. We participated with various organizations, whether it is a CI, the government, in supporting the COVID care centers, and then converting a lot of hospitals into COVID care competent centers, whether it is in Tejpur, whether it is in Dabur. So all these things, we started doing it. Uh, Bulk of them, I should say, they are more reactive, frankly, because we all are new to this pandemic and none of us could understand anything. So whatever learning which was we are gathering, now things came about immunity. Now, lot of doctors suggested that, look here, one of the best, because that time there was no vaccine in the first wave. So how do you do? What can we do? How well we can take care of ourselves to prevent this infection? The first thing was immunity. And the number of activities we did on immunity in the communities was far too many. So those things we thought, let us talk about prevention. When the vaccine comes, we talk about vaccine. So that's we started. The moment vaccine came in January 2021, we participated in terms of advocacy. First, it was healthcare workers. Only in March, it started with the general public. Then all our community, there was so much of hesitancy with regard to vaccine, that because a lot of miscommunications were there. And when we consulted professional doctors, they said, look here, whether it is effective 100%, 90%, 60%, but it is effective. So now it's important for all the populations to go through this vaccine. So that's how we started supporting. First, employees we did in the offices, factories we did, and in the communities. Then we started educating the village communities through the panchayats and the doctors. Look here, it is the only solution today available to us. Now, whether it is 50% efficacy also, it at least 50% is efficacy. Now, that's how we participated. As we speak, even today, we are conducting mobile vaccination centers, a doctor in the van going to the villages, because village community, they say, look here, how do we go to the center which is far off? So like this, multiple activities we did. Somehow the healthcare issues in our country, there is a lot of things we need to do. At least this is an eye-opener when we discuss as to what else we can do to prepare ourselves, whether it is a third wave or a fourth wave or fifth wave. I think some ideas I can give. Thank you.
Thank you, sir. Thank you very much. Now, Mr. Bisen, Ankur Bisen, could you please share your views? Could you turn your mic? Yes.
Thank you, Shweta, for this platform, and my pleasure to be in the company of the august audience and the gathering, and the speakers who spoke before me. Uh, I would like to make 2-3 points, not at the cost of repeating what Mr. Joseph and Mr. Sudhakar have also already said, but just build up on the points that the eminent speakers spoke. Uh, I like to summarize what Mr. Joseph and Mr. Sudhakar said as what the companies did during the pandemic. And my sentiment is in this one-line statement that there was a lot of intent of the companies to come out and help and open coffers to support the healthcare need, but there was not enough avenues to sort of ramp up and address the adversity at the scale that was needed and the time in which it was needed. So intent was not backed by avenues. And I think that says a lot in the way we look at the healthcare, or we have viewed healthcare as a public policy issue in the country over the past few decades. And for the corporates to look at healthcare in a more constructive and in a more proactive manner, not constructive, they're already looking at it in a constructive manner, but in a proactive manner, it is important that the narrative around the public policy on healthcare changes. And why it is important is for a country like India, the need or what the COVID crisis has shown us is that we can't follow any one model that has been modeled or replicated elsewhere in the world. Uh, if I look at a completely market-driven economy as a model to deliver healthcare, I think enough example of the COVID crisis has shown the deep flaws in that thinking. And if I just talk about a completely welfare-driven model, I don't think the government has the capacity to understand and probably deliver healthcare at the scale that is needed. Probably India needs a healthcare model where it imbibes both welfare and scale building as a need to deliver healthcare, and that's what the COVID crisis, has taught us. What are the 3-4 points in which or around which the CSR initiative for healthcare can be pivoted for the corporates? And my view is that either we can wait for an ideal scenario to emerge for corporates to say now we will start to sort of invest, or but in a country in transition or a democracy in transition, it will always be where you constantly improvise, learn, and move forward. And I think that's the way to think about these solutions. We have to first understand that what COVID has done, or a COVID kind of a crisis, is now a fait accompli going forward. The world will witness climate change, and with climate change will come displacement, will come disruptions, will come a whole set of new challenges around healthcare, and we need to build models around it. Second is the quality of urbanization that we are facing in the country that will face challenges. For example, quality of coverization is directly linked to vector-borne diseases that put stress on the healthcare system around dengue cases, around malaria cases. And come monsoons, you will see a whole range of healthcare emergencies emerge. And it is directly linked to vector-borne diseases, which is directly linked to quality of urbanization. So if we understand that climate change and quality of urbanization are going to confront India going forward, we understand that India needs a different sort of a model system where CSR of corporates are going to play a key role, around which we should be thinking about healthcare delivery models where corporates should be playing a proactive role, rather than to sort of look at avenues where the intent is there but the avenue is not there. There are 2-3 themes on which, and then I'll close and pause my comment. There are 2-3 areas that need urgent attention of the corporates. Basis what I have said. Preventive healthcare is one way we can think about healthcare delivery for corporates and CSR tie-ups. rather than to look at curative healthcare. So preventive healthcare can be broken down into themes like nutrition delivery. It can be broken down into health camps that can check healthcare and raise red flags on behalf of the government. Now, an example of this is arsenic poisoning. Arsenic poisoning is a big issue in Eastern India, in parts of Bihar, in West Bengal. Can corporates be roped in to create health checks where arsenic poisoning cases can be alarmed, can be brought to notice, can be sort of looked at. Similarly, people who are associated with urban mining, they faces all kinds of issues in urban mining extraction. Can the healthcare camps be organized to sort of identify health risks, health audits that can be done as a data collection exercise for the government to sort of create responses. So one element of CSR for corporates is to sort of just create data, create a baseline of data where government lacks, to size the problem. And this problem is not about some national issues, but you can create thematic responses to create data collection. Second is, I talked about preventive healthcare, nutrition delivery is a big ask. And third is primary healthcare centers. How primary healthcare centers can be looked at in capacity building, where CSR can be roped in to increase the capacity building. And that may be training for doctors and nurses, paramedics, increasing the equipment infrastructure of existing healthcare, where and probably talking about different ways to sort of deliver primary healthcare. These are three areas I think which are urgently needed. But overall, I made the point about looking at healthcare differently that can create good avenues for CSR of corporates to be channeled in healthcare, which was found wanting during the COVID crisis. Thank you.
Thank you. That is very relevant. And
Shweta, I have a question.
yes,
Can
please,
I?
Somesh, go ahead.
Yeah.
Yes.
So my question to Mr. Is to Mr. Sudhakar Rao and Mr. Nixon Joseph both. During the pandemic over last 1.5 years, the health sector implementation agencies, they were quite comfortable working offline in health sector basically. Now, since the COVID protocol came in and everything, we could not go on ground, we could not do much on ground activity. So how do you find how prepared these implementation agencies were for implementing the CSR projects? And now, what are the gaps and where can they now prepare? How do they prepare for the next 1.5 years of the same model in which they have been working over last 1 year, if they have to work again? So how prepared they are? What do you think and what are your suggestions on that? So that is one question. Second is to Mr. Ankur Bisen and Ms. Shachi Singh, is that where do you think is that how quick were corporates to design and conceptualize program that was meeting the emerging needs in healthcare sector? And what are your suggestions to corporates? Yeah, so we can begin with Mr. Sudhakar.
Thanks, Subesh. You are very right. See, all our actions in the past 18 months were mostly reactive. Then, having learned from those 18 months, what we personally feel is that, as Mr. Ankur said very clearly, what is the healthcare delivery model we are going to see tomorrow, day after? That's very important, because to create a healthcare infra in any village communities or towns, it takes hell of a time and money. And I don't think private sector is very enamored to set up a hospital of an Apollo or a Medanta in any of these small towns, because it is not economically viable. If that being the case, how can you bring a world class, or at least India class healthcare delivery model to our village communities? We feel that telemedicine, community telemedicine or individual telemedicine, because today, if you see the smartphones, almost 90% of our village communities have definitely one cell phone in their houses. Definitely. We have seen both for education and now healthcare. So what we are currently working on a POC, a proof of concept establishment, through two organizations. How do we have a virtual telemedicine activity working through the community level or at the individual level? I think maybe another 2 months, we will have a clarity in the state of Himachal Pradesh. Can we process this? Like Mr. Ankur said very clearly, nutrition is the biggest problem in the villages, because most of them have dal chawal at finish, no vegetable going into this thing. With the result, nutrition causes so many other ailments, including the problems with regard to immunity. So that is where we have started a program called Ghar Ki Baghiya, where we supply saplings, seeds for the village communities to grow basic vegetables in their household, because all of them have land. So we said, let us go through an integrated approach where right from nutrition, telemedicine, and other advocacy issues we can combine in such a way that we at least support as much as possible in the healthcare delivery model today, tomorrow, because infra, it is less said the better. We are setting up 3 oxygen plants. We have a hospital which is 130 beds, but there is no oxygen facility. So this is a reality after 75 years of independence. And that, I think, I don't think we can create infra overnight. Yes, we have done very well in the PPE kits. We have done very well in the N95 masks. A lot of things we have done. But the population we have, the spread of villages we have, I don't think we'll be able to create a model where we can have a physical infrastructure in the village communities like a primary health center for a long time to come. We may have budget of 225,000 crores, etc. But actual delivery, it might take maybe decades. If that being the case, how can we bring at least a particular level of healthcare delivery system through using technology today? I don't think we have any other option but to proactively work on it, besides what Mr. Ankur suggested in terms of supporting the nutrition for the village communities.
Um, yes, ma'am.
If I may be allowed
Yes,
now
ma'am.
to
Please.
take up my... So wonderful. I think this is very interesting discussion happening, and thank you for inviting me here to be a part of this panel discussion. I'll take up the first question that Shweta and Somesh just asked, that what was the response of the corporates? I think wave 1 and wave 2 had very distinct differences. Wave 1, the lockdown, which led to, everybody focusing on the basic need of food and hunger, and, then transporting people from one place to another. And definitely the corporates stepped up for that. And I see it in 2 segments. One is for healthcare workers and the other is for the community. The stark difference was that usually you see civil society approach corporates for funding. But the difference was that the corporates were calling, how can we support? And that, I think, is a great, it's a great teller to say what Ankur was saying, that there was intent. And they were looking for avenues that how we can support. And they were open to accepting that we don't know. And you tell us, where is the need? What is needed? And that, I think, is definitely should be appreciated and lauded. A huge amount of funds have been spent on that. Now, the other thing was that wave 2, on the other hand, was more scathing, more cruel, and the needs were very different in terms of, where actually everybody's panic buttons were hit and people didn't know that what we should do, because there was even if people had the money, they did not have access to a lot of products or items that they needed to get or buy. Or so gradually, I think everybody geared up to face that challenge. And I think I would say that it was the quick policy decisions also which allowed corporates to step up and do funding for COVID should also be considered as a great practice that was done, and which helped them to take quick decisions as to, yes, let's buy oxygen concentrators, let's set up isolation centers, which otherwise they would have not been able to do. So that's the one thing. The other part, as Somesh just asked, that what more could have been done, or what more should be done for the future COVID crisis that may or may not happen, but yeah, we are definitely there. I'll share my observation and personal experience. So wave one and wave two, I was definitely part of a lot of civil society groups and government groups, and was on ground zero in both waves, where we were, doing the ration. Also, we were working for hospitalization, oxygen, and also cremation. Wave, so it's all of that was happening. I was also part of groups and which were actually following the Indian traditional systems of medicine, or Ayush. And it is very heartening that the government, under the leadership of the Honorable Prime Minister, actually issued COVID protocols through the Ministry of Ayush. And there are innumerable researches, studies that are on the website of the Ministry of Ayush. And within its limited resources, the Ministry of Ayush tried to reach to both urban and rural population. But unfortunately, the corporates' support to this whole initiative did not take off. It was very minimalistic, if it was somewhere. And understandably so, because the focus was definitely on other things. And there is a lot of evidence to say that it had a lot of impact. And I think Sudhakar ji was indirectly also trying to take us to that direction, that, a lot of preventive work can happen through Ayush. So that comes to my first suggestion, is I would really look forward to corporates come in support to Ayush and start understanding this whole system, which is a proven system for more than 5,000 years. And a basic principle that it works on is that we need to rejuvenate and preserve the health of the healthy and alleviate the disease of the sick. But what we see, and it is apparent, that a lot of funding and support goes for alleviation of, disease, rather than the preservation of health, which is disproportionate, and which leads to this, reactive models that we have to adopt. And so definitely this would like to see more corporates to do that, and the low cost, most effective means of health is needed for the last mile will be possible. The other issue that has come up is of telemedicine, and I do not deny the need for it. I do not deny that it has been effective where people could not reach. It has worked in some places. But at the same time, I would like to draw the attention of the eminent panelists and the group also to the fact that we cannot underestimate the investment on individuals and human resource and their capacity building. And we have to balance between investment on technology and investment of trained human resource that is locally available. So that disproportionate also, I think, because COVID has taught us the technology way. And we must remember that it is not, it was adapted not for normal times, which has become the norm. And over a time, it is against personally, I would say, against the whole human need to connect socially, also to be able to meet people. So somewhere that balance needs to be there. And I think within our villages, we have some extremely extreme abundance of knowledge that needs to be collected, documented, preserved, blended with technology, and to create, invest in humans and not just technology, where we have trained paramedics, naturopaths, folk traditional practitioners. And I think India has that potential to show to the world, what it takes to stay healthy. This is a knowledge that, emerges here. And we must accept, upgrade, and learn to present it. Investing on research in this direction could be one of the greatest investments for generations to come, not just for COVID, but for any other health issues that we are looking at. And to make affordable health a reality, I think is one thing. Quickly, I'll just say that, another issue that remains untouched, not just for COVID, but since it's very close to my heart, is the issue of children. And especially children in that larger set, the smaller subset of the most vulnerable children who are, child laborers in abject poverty, exploited, abused, trafficked, and they remain definitely on the borderlines, and corporates somehow shy away from coming on center stage for that. And I understand, because a lot of things are about money and scale and numbers. And in this segment, it has to be about in-depth innovation and out of the box. And it has to be, so the investment on one child who is already vulnerable is probably more than investment on 10 children who are, just where we are just investing on education.
Okay,
So
ma'am.
that,
Excuse me,
also
ma'am.
understanding.
Sorry, ma'am.
Yeah.
Actually, we are supposed to. We have the panelists for the second panel with us. I'm very sorry to intervene in between, but
Sure, I'll just take 1 second and
yes, please.
wind up with this, because I've patiently listened to everyone. So just give me a second to wind up, and then we can take up. So just to wrap up and say that, the corporates' need of the hour is for social workers and corporates to work more closely. And we need corporates need to understand also the importance of the grassroots passionate change makers and work closely with them. That would definitely be a big strength for this nation. And we do know that we don't know really how COVID is going to shape up, but just 3 things: that we need self-sustainable community-based models. We need to start measuring impact, not just in numbers, but quality. And thirdly, that we need to invest on the preservation of health and not just in the sickness or disease. Just 3 things that I wanted to say. And definitely big gratitude and congratulations to all corporates who moved out of their comfort zones and stepped up to serve the nations and did their, so definitely great work there. Yeah, thank you, Shweta, for that extra.
Thank you, ma'am. No, thank you so much, ma'am. There was a lot to take from your presentation. I'd now, because we're out of time, I wouldn't be concluding in detail, but I've got a lot of material for my conference notes. Now I'd like Ruchika to take over and begin the next panel, because we already have the panelists with us, I believe.
So thank you, Shweta. And speakers, thank you so much for your valuable contribution and your stimulating discussions. I'm sure this will pave the way and mark the beginning for future deliberations and discussions on the road ahead for CSR efforts in the healthcare segment.